So I think our point in time right now, I believe Winston Churchill's famous quote applies to this exact moment in time. Now is not the end. It's not even the beginning of the end, but it is perhaps the end of the beginning. So we can't really talk about telehealth without talking about COVID-19. As you guys all know, COVID is really driving the changes in telehealth. We find ourselves faced with so little as well as so much information and data at the same time. In addition, we're undergoing change at such a rapid rate that many are left feeling discombobulated, and they often don't really know how to react to the situation or what to do next. So to simplify, we're going to break down where we are into three phases. Obviously, there's the initial response. We all basically did what we had to. Back in March, we leveraged the tools that we had. And now we're starting to enter into phase two, or as Churchill, I believe, would say, we're at the end of the beginning, and most of us are starting to enter into phase two in kind of evaluating, reflecting back on what we've done, how we responded, and then preparing for what's next. We really don't know exactly what's coming up next. So is this going to be a slow burn? Are we going to have rolling epicenters with waxing and waning? Are we basically going to have a large second wave? We don't really know, but we do know it's time to reflect and prepare for what's next. So I think a lot of the outpatient opportunities are pretty evident, but some questions I'd like to ask are, what can we do in the acute care space to better leverage telehealth? How can we leverage it to limit clinician exposure, preserve PPE? How can we leverage it to help us load balance or transfer patients across organizations or even regions? How can we leverage to provide better access to those that are in underserved areas or communities? Can we use telehealth to help us select the appropriate destination facility or level of care? How can we use it to meet patients where they are now? How can we leverage telehealth to do things like work better with EMS, long-term care facilities, alternate care sites, and other organizations? Some burning questions in the South might be, how do we deal with a COVID surge in the middle of a hurricane? So I believe systems of care really highlight the fact that we must unite, and we're all in this together. Inter-organization communication with fax, phone, and radio are obviously no longer acceptable. I personally believe that how we work with others will be the defining characteristic of our response, and I believe telehealth will be a key driver of that. So as we kind of take a step back and reflect on where we've been, what's happened, I think part of reflecting is evaluating this initial response, what worked, what didn't work. I also believe part of reflecting should also really be personal at this time. So COVID has been bad. There's no bones about it. It's been bad. But when we reflect, it's also very powerful to reflect on what's been good. Many of us have given up so much. What do you not want to let go of? So instead of just using the Q&A box that Brian mentioned a while ago to fill in questions, please take the opportunity also to list some things that you've been thankful for or something positive that you feel like's come out over the last 3 to 4 months. So on a personal note, I've greatly enjoyed cooking and eating with family at home. When it comes to healthcare, I think one of the biggest things is telehealth. So telehealth expansion is, I believe, one of the positives that has come out. There's tremendous long-term implications on quality, on value, on access that will serve for generations. Administrator Verma's famous Genie quote, I think, sums it up well. There's absolutely no going back. And what's fascinating to me is we've crammed decades of progress into 3 months. So it's really hard to look into the crystal ball. Telehealth is something that is still just rapidly evolving. Just last week, the U.S. Senate Committee on Health, Education, Labor, and Pensions met to discuss the 31 temporary federal policy changes in what should be permanent versus what should be continued. So I think overwhelmingly some of the things that they believe should be permanent are relaxation of the originating site rule or the patient location, and I think expansion of reimbursed services both in terms of types of encounters and the eligible providers. I think keeping those permanent to some degree are going to be in the future. Some things that we know that are going to be discontinued are the relaxation of the privacy and security standards. So a lot of us had to respond with non-HIPAA compliant solutions, and I think that time will be coming to an end. So I'll come back and discuss the implication of these more in a bit, but I'm going to pass it off to Tim Hakamaki for a deeper dive into the past, present, and future of telehealth.